I'm Dr. Lesley Forster. I'm the Dean of Rural Medicine at Charles Sturt University, which is part of the joint program in medicine with Western Sydney University. We will be able to have kids come and study in the country in a 5-year undergraduate program, and they will be able to learn about what it's like to practice in the country. It's only 5 years, which means that after 5 years you're ready to go out and practice as an intern. People in the program will be seeing patients and working with local doctors, often on a one-on-one basis or in very small groups. The facilities will be brand new and wonderful to work in, tailor-made for the program with all the equipment that's necessary. There's a $22 million building that it will house the first 2 years of the program. There's also another new building right opposite the hospital where we will be making the base for our clinical students, which is the 3rd, 4th and 5th year. There just aren't enough doctors working in the bush. We really need to give country kids the opportunity to come and study medicine so that they can become doctors and help alleviate this big problem.
I'm Dr. Ross Wilson. I'm the Director of Rural Studies at Western Sydney University. The program for Western Sydney and rural basis that CSU have got provides a good synergy. I think you've got the best of both worlds. You've got a university that in medical research is in some areas leading the world, and you've got Charles Sturt, which understands and works in the rural environment, providing a basis. And I think put the two together, you've got a pretty powerful combination. Both universities have an ethos to produce a local product, and I think that will stand them in good stead.
Sandeep Daratna. I'm a 4th year medical student. There's a lot of hands-on experience that you get. From first year itself, we are exposed to clinical medicine. You're in hospital a lot of the time, and from 3rd year onwards, you're pretty much in hospital. Doctors here, they want all the help that they can get. A lot of clinical exposure, which has been great, and a lot more one-on-one time with patients as well. My pediatrics rotation, my obstetrics and gynecology rotation, and rotations I've had in rural areas have all been such wonderful experiences, and I've thoroughly enjoyed it. And I think a person who really likes the clinical aspect of medicine would love regional and rural. What I've found is that doctors thoroughly enjoy their job, and the work-life balance, the ability to sort of work in a close-knit community is very convenient. And I think people should actually come and be exposed to it, and then they'll see for themselves.